So a cantilever, what it basically is like if we have an implant right here, and we have another implant right here, and we have, let's say, a little bridge here, there's no cantilever, right? We have pressure being applied to both implants.
You have two pillars, yes.
We have two pillars, but let's say...
For example, when it's a small bone structure, I cannot recommend 6 implant or 5. It's necessary for...
Yes. Well, the bone grafting is just it's a technique to keep the level of the bone. For example, when we pull out teeth, and mostly when it's a lot of teeth top and bottom, in where is the root, we have the socket right there. It's like it's the socket, the hole.
Hey, welcome back to Supreme Dental Podcast. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Remember, this podcast was made for you, the patients. And today, once again, we have the Supreme Squad here, and we're going to answer several questions that we got through email. We were very excited because we received some emails from patients that are actually watching this, because we made this for you guys, and not just to relax and chill. And one of the questions that we got, guys, is, but before anything, welcome back. So we have Dr. Alonso, we have Dr. Luis, and we all have Dr. Leah. So I'll let them say hi to you guys before we move on. Okay, nobody said hi. Well, hi to everybody for them. And like I said, we're not actors, so we don't do this for a living. We're doing this for you guys. We're doing this so you guys can understand better about the concept. You guys could, ask the right questions. If you guys decide not to come to Supreme Dental, that's not a problem. But we want you guys to ask the right questions and get the right information across, because there's a lot of wrong information out there, just like everything. So that's what we're here for. But one of the questions that we do get, guys, is so my dentist is telling me that I need to get 4, 6, 8 implants. I'm All-On-4, All-On-6, All-On-8, All-On-10. What makes a difference? Why can't we do 3 implants instead of 4? What makes you guys define how many implants to use on one of these structures?
Okay, it's a good question, because the denture depends on the stability of my surgery of the implants. Yeah, for example, imagine the table, a table. The table needs 4 pillars. Okay,
4 legs, yeah.
4. Imagine now 3 pillars. Has a good stability, but not it's the best stability. With 4, it's perfect. 5 or 6 is much better. It's the same situation on the mouth. With 3 implants, I cannot do a permanent solution, but I can do with 4 implants a permanent solution. Why? Because the pressure on the mouth of the bite is the same situation with the table, because the table, when you place any things over the table, has a pressure. That's why it's necessary the stability. Now, 5 implants, 6 implants depend of the quality of the bone. For example, when it's a small bone structure, I cannot recommend 6 implant or 5. It's necessary for...
Yeah, I think picking off on what he said, it's the more the better, right? But it also, we have to consider the bone quality and certain factors as far as the nerve in the bottom and the sinus in the top, right? I think that those are the 2 key factors that limit us on how many implants we're going to place. We also have to consider the patient, right? If he's a young patient, he or she is a young patient, or is an older patient, how big they are, how much pressure they're actually going to apply. Before it was said that the All-On-4 was enough, but now we've come to realize, and there's research out there, that the distal part of the bone, especially in the top, because it's very soft, throughout time, those implants can wiggle a little bit because there's too much pressure being applied. So it's always better to place more than just 4, just in case, let's say, one of them fails. If we place 6, we still have the other 5 that are ready to go, and we can place the 6th one at the time we deliver the final prosthesis, and we have 5 that are ready to go, and plus 1 more. It's very important, especially on the back part, top and bottom, to eliminate any cantilevers, because that's going to apply extra pressure. The screws on the prosthesis might get loose, or the implant itself might get loose. So I think it's going to be that the patient, the age, how much strength they apply, and anatomical structures that are going to limit to how many implants we're going to place.
So, quick question: you say cantilever. So what is it exactly? Is a cantilever?
So a cantilever, what it basically is like if we have an implant right here, and we have another implant right here, and we have, let's say, a little bridge here. There's no cantilever, right? We have pressure being applied to both implants.
You have two pillars, yes.
We have two pillars, but let's say our prosthesis extends to the back part, and any pressure being applied here is going to be more pressure to our implant over here.
This is stress.
It's a lot of stress, right? We always try to avoid any cantilevers. Sometimes we thought there wasn't any options, but now we have other options to eliminate that cantilever. That's going to apply extra pressure to our implants and to our prosthesis as well.
So pretty much a cantilever is when you have an implant and the final work exceeds that implant further back.
Right.
Not having another pillar to connect to, then it has more problems of a wiggle problem, and then in having problems with the implants in front.
All right. The stress that's being applied there, it's kind of like a ledge.
Okay.
Right. So the screws might get loose. The prosthesis might break.
Okay.
Depending on the bone quality as well, especially on the top, the bone tends to be softer, and it's extra pressure being applied there. So the implants sometimes fail. The screw gets loose. So there's a lot more problems to it, right? Or sometimes, if we don't want to do the cantilever, we have to do a shorter prosthesis, right? But there are solutions to that, especially in the top. We could look for extra maxillary implants that are on the upper part. It's going to be pterygoid implants. With the pterygoid implants, we're going to access better bone quality. That's a lot denser bone that's always going to be there, and that's going to eliminate the cantilever in the top. That should be a must. That should be a must.
So touching back a little bit on what Dr. Luis said, he talked about a table. So a table has obviously the four legs, and it applies the pressure of whatever you put on top of the table on those four. When you have three, you'd have more of a wiggle type of deal, and you don't want to do that. So I definitely understand what you're actually saying. It makes total sense.
Welcome to Dental Facts. Did you know ape and human teeth have the same shape? You heard it first at Supremedental podcast. Floss, brush, and keep smiling.
So, what you said the better. Dr. Leah said the more is better. So, what do you suggest when you're choosing to do an all-on-4 and all-on-6,
Mm-hmm.
and you have to distribute the different newtons, the different pressure that you do on the implant itself? How do you define? How do you say, well, you know what, if it has this much torque, or if this much torque is divided into the implant, it's going to be successful? How does that go? How does that work?
Well, for sure it depends the quality and the density of the bone. Always we try to make a really, really good torque, because that's the success eventually to get the final work. Basically, like you say, the doctors say is all-on-4 is with 4 implants is enough, but the all-on-4 is designed to avoid the important structure, like the top is the sinus. That's the reason we have to place the implants in angle.
At an angle, okay.
In angle, and in the bottom we have the nerve right there. It's the same thing. We have to avoid that structure. So, but for example, if I see a patient with a big muscles, for sure I highly recommend you place more than 4 implants, because 4 implants is not enough for all the force of the muscles. So always we try to place more than 4 implants.
Okay, so it's kind of like when you have your car, you have 4 tires, but you also have a spare.
But remember, not the same bone, the top and the bottom, because in the 85% of the cases, the bottom bone is very hard. It's a type 2, type 1. It's possible to do the cantilever, because the quality of the bone is much better. But the problem is with the top bone, because it's very soft. In the 95% of the cases, the top bone is very, very soft. That's why the recommendation is check for pterygoid implants.
Right.
Okay, because with this situation, I can eliminate the cantilever.
On the softer
Okay, it's the
bone.
most important on the top area.
Yeah, and I think it's very important for the patients to understand as well that the All-On-4, that's a trademark name. right? That's a trademark name from an implant brand, but what we use is full arch surgery. So just because it's called All-On-4 doesn't mean it has to be 4, right? That's very important.
That's why some people say all on X, right? Because it could be
Yeah,
all
all
on
on
4,
it's fine
5,
now.
6, 8, whatever.
It's
That's
all
correct.
All on six,
Okay,
yeah.
no, that makes perfect sense.
Yeah.
So, going a little bit back on the torque, the pressure that we need to put on those implants, because a lot of patients say, well, if you do 4, if you do 6, is it going to be stronger structure? How do you guys define? How do you know? I have to put so much in one implant, or if I don't get one in as much in one implant, what is that number? What is that secret number? Is there a secret number?
Yep. The minimal torque is 120.
120 newtons added from all the implants.
Yes.
Okay, so if you get 40 on one and 20 on the other, and
20, yeah.
and so you just pretty much just add all of them.
Right. There's also a minimum of any implant. Just if 15 or less, that's no good.
Okay.
That's good. No, yeah, that's good.
So
Okay.
anything above 15 and the other ones are great, we're good to go.
So on the pterygoids that you were talking about, what is the type of torque that you can get on the pterygoid implants?
A chingo de torque.
Chingo de torque.
Chingo de torque.
That's a lot. That's a high number right there.
Yeah.
Yeah. For example, for implants, if each implant has 3 newtons, 35 newtons, 4 is 140 newtons. Is complete the work, okay? But the minimum is 120 torque, newtons of torque.
120 Newton torque.
Yeah.
Yeah.
You just actually did some pterygoid implants this past week.
Right.
What is the torque that you got on them?
I got up to 70. I probably had more, but that's how much the wrench actually marked. I probably had more.
So
for sure.
70 on each?
On each. Yeah.
So you pretty much got 140 on torque on 2 implants when 120 is the least that you can get on all 4 implants. So you were already above that.
Yeah.
Yeah.
So that pretty much secures my immediate load. That
Okay.
secures it for sure, especially on the top where the bone is very soft. And if I'm able to access really, really good cortical bone with just those 2 implants, pretty much the rest of the surgery is a piece of cake.
Now, Dr. Alonso, tell me a little bit about bone graft, because that's another question we get is people come in and they get, 28 extractions, and they want to get 4 implants on top, 4 on bottom, and then we need to do some bone grafting. And patients out there say, what do you mean I didn't have any bone, or I came with teeth? I mean, they were kind of loose. So how does that work? What does that entail?
Yes. Well, the bone grafting is just it's a technique to keep the level of the bone. For example, when we pull out teeth, and mostly when it's a lot of teeth top and bottom, in where is the root, we have the socket right there. It's like it's the socket, the hole. So we have to cover completely with bone after to do the pull out teeth. Why? Because we have to keep the level in the same way. So just to avoid more like a gum receive eventually, we have to make bone grafting. So basically is place bone inside the sockets to keep the level.
To preserve the bone density.
Going back to that, I remember that obviously I had to learn all those things. I'm not a dentist, so I had to learn all these things from the dentist here. And one of the things that basically really captivated me was you guys speak dental.
Right.
So you guys speak and not somebody that's not a dentist or works at a clinic sometimes understands what you guys are trying to say, because you guys, obviously that's how you guys are wired. So how I was explained was, think about a pot. So you get a plant and you have a pot, and the plant's kind of wiggling, right? And you take the plant away. If you put another plant just in, the plant's going to keep on wiggling. So you put the plant in, but you fill up with dirt. So it's nice and steady. So that's how I was explained that a bone graft, that's why a bone graft was done, so the implant can be more secure, can be more successful.
Right.
So yeah, so that's in. What about membranes? Because patients always ask membranes. What exactly is the membrane? How does that work? How does that work on the bone graft?
Well, yeah, for sure. After to do the bone grafting, we have to place a membrane. Usually, it's a membrane collagen. This is just to protect completely all the bone, all the basically the bone. So we have to protect all the structure with a membrane collagen. After that, we have to place stitches. And now in market exists a lot of brands, a lot of type of membranes. We have one of them is a long-lasting membrane. This is gonna take around like 3 weeks, a month, or another one have to take two months to dissolve by yourself. But usually it's just to protect completely all the bone.
Right. It's a device that we use. A membrane, pretty much what it does, it divides tissues apart. When we have big bone defects and we need to add bone graft, right? We put a membrane on top just to divide the bone from the gum itself, right? Because gum heals quicker than bone. If we don't put anything there, the gum's probably gonna grow quicker than the bone, and it's gonna invade that area. So pretty much a membrane, what it does, it divides the types of tissues that we're using. And as Dr. Alonso mentioned, we have short and long-lasting membrane. So depending on how much we want to regain, or depending on the bone defect, that's how we're going to pick out which membrane we're going to use.
Not just that, you guys also use dissolving stitches, so your patient doesn't have to come back to take those stitches out.
Right.
Which that's actually a huge thing, because we get a lot of patients ask us, hey, so do I have to come back all the way from Florida to get my stitches removed, or who do I go with? And they will dissolve by themselves. So
right.
So that's something to look into right there.
The patient don't need come back after the procedure. Why? Because the stitches is dissolved by itself after in a month or 3 weeks, 4 weeks. It's very easy. For example, if the patient can see any stitches loose, can remove after 3 weeks, 4 weeks. Okay, not necessary come back here after the procedure.
So another thing that we get is patients say, well, you guys have immediate loads. Well, why should I get immediate loads, or I just get temporary dentures? Now, the investment, if we break down the investment to get immediate loads, for example, let's say on the bottom portion, you're looking at less than $9 a day for those 6 months, which that adds up real quickly, because if you get temporary dentures, they'll start fitting a lot bigger very fast, because your gums will heal and they will shrink. So then you have to fix the dent, or you have to come back for a reline, or you have to go to your dentist back home for a reline. So immediate loads tend to be more profitable for even the patient itself. That's an investment that you probably want to take.
Right.
And also with that, guys, we get a lot of patients that get the temporary dentures. They're removable. Like back in the day, they removed their dentures and then they don't wear them. So then when they come back, they're not used to having teeth in their mouth anymore. So then it's like kind of like being barefoot with no shoes for like 6 months, and now you put any type of shoes and it feels weird. It feels different. So we always tell them to keep them on as much as possible. If for any reason they're back home, we could take them off, but definitely the immediate loads solve that issue. So it's an honor to be here with you guys. Not everybody can sit down. I mean, we're completely blessed to be part of be part of Supreme, be part of Supreme Podcast. We're blessed to be able to do this for you guys. But we have a doctor who just came back from Argentina. We have a doctor just came back from Harvard, and in Switzerland we have a doctor that just came back from Spain. So everything here it's based on what they've learned. Everything here is based off on what they see and what we see on the day-to-day basis. So these are all of our opinions put together. Their opinions. Me and my wife, we're not dentists, but obviously we learn from the best, and we always tend to move on forward to whatever else is out there. We're always moving on forward to see what's the best technology. There is more technology in the near future, high technology that we've ordered since the beginning of the year that's going to come from Spain, and you guys will hear about that in a bit. But that's going to definitely change. That's changed the game of a lot of things.
Right.
When these hybrid dentures or these All-On-X dentures it used to take 2 weeks, then it took 8 days, and now it's gonna take 3 to 4 days. So definitely that's gonna be a huge thing.
Right.
So one thing also is, and I like to do this all the time because I like to throw just curveballs at everybody here, so you guys know that is not something that's been we trained for or anything like that. So I know we talked about previous patients that you guys remember, that you guys that has really left a mark in you guys, and you guys really remember automatically when you guys think of a bad case. But right now we're gonna ask each and every one of you guys to talk a little bit about a case that you guys were just like, wow, this is amazing. I actually did this. You know, it's like a big difference in somebody's mouth. And we're gonna actually be posting the pictures, so you guys know that these pictures are actually real of these patients, without naming anybody's, without mentioning names. Of different things that you guys have looked into, or cases that you guys have done that really you guys made a huge difference. So let's start with you, Dr. Alonso, because you're on the good looking side. What case do you remember that is just like?
Well, I have a lot of cases. They are really important to me, to my professional experience. But the last time we talked about one of them is really important for me. But probably the patient can look in the other podcast. But I have usually when the young patients come here with a lot of cavities, a lot of infections, I identify a lot with the. Because, for example, they have between 28, 30 years old. That's my age. So sometimes it's a little complicated to do this kind of procedure in this kind of patient, because it's completely he can be my friend completely and do all those extractions and implants and all that process. Always we need to work together to do this work. The final work can be great. So like I say, I have a lot of patience in always is different in every patient, but in a young patient is where I can identify more with the.
So we're gonna go ahead and put a picture of one of the young patients that you have actually done a restoration on, so patients can see what you're all about.
Mm-hmm.
And what about you, Luis?
Yeah. Okay. Yeah. I agree with your opinion. In my experience here, when come back here, very young patients, my first option is to preserve the teeth, all teeth. Okay.
Yeah, because we get a lot of people that want to extract and they're very young.
Because it's probably this human need maybe 2 or 3 treatments on the life, okay? But the first treatment is
yeah.
over the natural teeth. I don't know, after 10 years, 11, 12 years, the second treatment is the implant, okay? But now this patient has 30, 35 years, 40 years, I don't know. Okay, but the second stage is the implants, the process with implants.
But you know the reality here in this office, I think in all the Algodones town, the reality is different.
Yeah.
For sure, like 20-30% of young patients come here just for looks. Veneers are really smile makeover, exactly. But the 70%, we can do nothing for try to save teeth, even root canals, even crowns. So we have to make implants, exactly.
Or you guys have to go with a little bit of both. I know that a lot of patients that come in to get a smile makeover can't. And a lot of patients that want to come and extract the teeth, they have really strong roots. So it's kind of like a hit or miss. Has to do with sometimes drugs, sometimes has to do with medications, genetics. Right. I mean, there's just so many different things. So I'm gonna pick one of my favorite cases for you, and I'm gonna put a picture right there, and it's gonna show one of my favorite patients from you. So you'll be able to see it back home of his before and afters of somebody that just came in to get implants, but walked out with a full mouth restoration. What about you, Dr. Elias? What do you?
Well, as Dr. Alonso mentioned, that like every patient is special, right? And that's the thing about us is that we're doctors, but we're not machines either. You know, we talk to the patients, we relate to the patients and where they're coming from. And so I had a patient this week. He came in, he wasn't really looking forward to the treatment because he was nervous. He was scared. It was something that he's been trying to avoid for a couple of years now. and his mouth showed it, right? But he was just here, and he was happy. With the first part of the procedure was to diagnose, talk to him, take pictures, scans, so we can plan everything out. And you can tell he was nervous, right? And he didn't want to be here. He had to be here, but he didn't want to be here. And the first step was to do the surgery. And right after the surgery, he left while we made the temporary immediate loads. And we talked after we put the teeth in, and I told him what was the best part. And I thought he was going to say, hey, well, I really like the teeth. That's what a lot of people say for cosmetics. But he was really happy that he didn't have any pain, that he finally didn't have any pain, that he could finally eat and not worry about one of his teeth breaking or one of his teeth moving. So that was kind of cool, because a lot of people look at, just the cosmetics, which were great. I mean, we're going to show pictures. The smile makeover, the All-On-6 was great. Everything went great. But he was just happy that he could finally eat, and he didn't have to worry about teeth breaking. And he even mentioned to me that he didn't care the couple of hours that he waited for the teeth to come in. He was just happy that he didn't have pain, that he didn't have, that it didn't smell, that he was just happy that he didn't have to worry about that. So I thought that was pretty cool.
Is that the patient that got pterygoid implants?
That is correct, yeah.
So we'll go ahead and post that picture of the before and after, and also the x-rays in between. So.
Yeah, and he was told in another offices that he wasn't going to be able to get implants right away because of the infections that he had and the amount of bone that he didn't have. But with the courses that we've been taking lately, we can reach other types of bones, and then he's going to be able to. He left with teeth. That was pretty cool as well.
Right before we leave, guys, is that's one of the things that I really, really dislike, is that when you go somewhere and they have a limit, then they tell the patient, what, it can't be done, or no, it probably you can't do it. Doesn't mean it can't be done. I mean, I think there's different treatments right now all over the world that it makes it not impossible, not impossible, but it makes it extremely hard for you not to be able to get something done. Right. So maybe the capabilities of that clinic are not what you're actually, not for your case, but doesn't mean that you quit looking. You got to look for what else is out there. I've seen patients that come in and say, they told me I couldn't get implants. And they can, but they weren't extremely hard to put on.
Right.
Or maybe they needed a couple of sinus lifts, or now we have the pterygoid implants, and just patients just forget, you tell somebody you're not going to be able to smile again with something permanent, you destroy them, so. Right. But yeah, guys, thank you so much for being here. Thank you so much for being here. We appreciate you guys being here, taking the time to do this. And thank you so much here at Supreme Dental Podcast, guys. Thank you for watching. Don't forget to subscribe and like. We will be doing more and more of these videos in the near future. And don't forget, Supreme Dental Podcast is sponsored by Supreme Dental, where smiling starts here. Thank you so much. Thank you, guys.
Thank you.